John, I tried to get you an invite to the White House, home of the Whopper, but I did the next best thing instead.
If only Congress could have it their way.
Welcome to CareTalk, your monthly home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. David, Governor Gavin Newsom, the new governor of California, has come out with a very long list of policy proposals, a lot about healthcare. What do you think of his ideas? They're pretty broad-ranging.
Well, John, I guess it is sort of the California dreaming version of policy. You know, a lot of stuff, I think if you look at healthcare, he's basically saying, we're a nation state and all that stuff about undermining Obamacare. No, we're going to take it on. We're going to have the mandate for everybody, including we're going to be covering people that are undocumented or illegal, depending on how you look at it. $260 million being put to that. 300 and some million dollars.
Those are children, David.
Yeah, I know, but I'm saying he's trying to do this. I don't think they have the money for it. Universal coverage. He thinks he's going to take on the drug industry by bulking up and negotiating with them. I think unless you're prepared to say no, you're not going to cover a drug, you don't have much leverage. I think, John, frankly, it's nice stuff. It's kind of nice talk, kind of superficial, pretty plastic surgery looking stuff.
You're being too unfair.
He's not going to get anywhere with it.
There's some good ideas in there. He's expanding and supporting in-home benefits to folks who are at risk, which is going to lower the total cost of care. The aggressiveness of having a state that covers 13 million Medicaid recipients to kind of negotiate and asking other governors in is really powerful. There's 60 states around the country in the last 2 years, or 60 bills rather, around the last 50 states that regarding drug pricing and curbing drug pricing, and in some cases aggregating purchasing power. I think we may be at a tipping point for states to join together, and I think the ironic but potential alliance between President Trump and Gavin Newsom could actually, if you bring the feds in with the state, you could actually see some pretty serious movement on at least slowing down the unnecessary price increases for drugs that have already been in the market for decades.
Well, John, I think you're being a little bit hyperbolic. I mean, with the 60 states is one thing, but I think it's more likely
there aren't 60 states.
Well, there's 60 states of mine.
60 bills.
Yeah, okay.
50 states. See what I'm working with?
Right, it's good. Let's see what you got to work with. I know I'm listening though, John. But I think it's more likely that Trump is going to launch a missile. Let's face it. He said they're not going to give him money for the
or missile.
Well, they're not going to give him money for the fires. He'd like to take it away because he thinks if you just did let the forestry companies in there, everything would have been fine.
You got to give him credit. He's been consistent on drug pricing. I think there is a coalition of the willing forming at the states. You bring that drug purchasing power together, you could really see some movement. I think people underestimate the power of shame plus purchasing power could have on drug pricing.
All right, well, we'll see, John. But let's stick in California, a little more California activity, because I know after your long sojourn and relaxation during December,
it was great.
You go out to J.P. Morgan healthcare conference in order to hobnob with the big ones on Nob Hill and enjoy all the fun stuff.
Let's give some
conference.
Let's give some context. So J.P. Morgan is a conference where probably 20,000 leaders in healthcare from all over, from hospitals and pharma companies and insurance companies and small new tech companies that are serving that industry, all get together to talk about what they're doing and how they might work together. It's called J.P. Morgan because the bank sponsors the Prime Conference, but there's almost a conference around the conference. It's the beginning of the year. And there's actually a lot of, it's an interesting window into what's going on in healthcare. And I think it is a bit of a tale of two conferences. One, a pharma-facing conference where I think there's a lot of interest in novel new drugs, including some stuff that is really game-changing, whether it's depression or cystic fibrosis or a number of other chronic diseases where our industry is engineering drugs to dramatically change the treatment and healing for patients. And the rest of pharma that's really focused on can they jack up the prices even more for the drugs they've already been had out in market for a while. And then for everyone else, the small tech companies to the large insurers to the not-for-profit hospitals, there's really a conversation about how we convert the current activity and spend in healthcare into value, which I think for most people means better outcomes at a lower cost. And regardless of how they're approaching it, that's one part of the conference, whereas pharma's in a very different place. And there's a lot of exciting new things going on. I'm actually a healthcare optimist, David.
John, that's good. I think JP Morgan, you mentioned nonprofits. I think, one of the reasons that some of these companies are nonprofit is they spend $10,000 on a hotel room to go out into JP Morgan.
Perhaps you did.
I'm glad you got a better deal with Airbnb. John, I think that the one concern I have when we talk about value, in healthcare is really just about kind of, squeezing cost, and it's kind of a zero-sum game. I do think it's important to focus on value if we're gonna look at universal coverage like we're talking about in California and other states.
But David, you've got to agree, we cannot afford to have over 20% of our GDP consumed by healthcare.
Agreed, John.
When the rest of the industrialized world, it's like 12 to 15%.
At most,
I think there are three levers of value. One is we can squeeze some costs out because things cost too much.
Yeah.
The second is we can reduce costs that we don't need to spend on things like excess margin for, let's say, insulin that's been out here for 100 years and for which there is no innovation. And you could take those dollars and expand coverage. And the third is finding lower cost places to care for people and engaging families. That's what we do at CareCentrix. One of the single greatest opportunities to lower cost, improve outcomes, and delight patients is to do more care to the home. There are sources of value that aren't just squeezing, although some squeezing, honestly, is necessary.
Well, John, I'm glad that we've gotten off to a nice, cheery and wholesome and optimistic start to the year. But as we get beyond January, what do you think are going to be the really big healthcare topics of the year? Is it what you saw at JP Morgan?
Well,
Is it Gavin Newsom?
I think
what's going on?
The two things that I think are interesting and that are still building as stories for 2019 or themes for driving healthcare innovation. One is the impact of artificial intelligence and machine learning on process flow as well as clinical decision making. And the other is, frankly, the increasing acceptance of the non-clinical barriers to care. People call it as the social determinants of health, but it's really all of those things that are inputs, costs, or influencers on bad health outcomes. If we could get great at both of those, I think that's a way to reform healthcare and improve outcomes and lower costs.
John, I'm not going to argue with you on social determinants of health, but I gotta call something on you on AI and machine learning. So to me, here's where I think artificial intelligence, kind of like artificial sweetener, where it's going to go. So instead of using it for these great, wonderful things to improve clinical outcomes and all that, what happens is they say, hey, instead of having all these live customer service agents, I'll have this chat bot, and then it'll be like Eliza. I'll say, hey, I have this problem as a customer. I have this problem with the company. And they'll say, oh, what do you think about it? And just go back and forth and keep the problem from being resolved.
David,
and just try to mill me out.
Keep your customer service interactions out of the podcast. That'd be awesome. I think what you're going to see is even in the automated assistant and bot world, they're going to get better and better at meeting even your endless needs. And what the advantage of targeted use of machine learning is going to take costs out, meet consumer needs faster. I mean, Oscar today, by digitizing everything, the health plan, by digitizing everything and evaluating it digitally and applying some machine learning, has a pretty effective way to predict who's going to hit the ER in 72 hours from after they've analyzed the data. The more digital data we have, the more we can predict, intervene, and help patients. And I also think you're going to see automation of a lot of customer interface, because frankly, the customer interface in healthcare today, human to human, the way it's currently structured, in many cases is terrible. And so the bot may actually be an upgrade.
No, well, that's a sad statement, John. I mean, to me, I'll say long term, maybe we're there, but to me, machine learning is mainly me learning. I don't want to talk to a machine.
Well, David, speaking of your learning,
yes,
you were chatting before the podcast about this new book, When, by Pink. Right. Not the singer,
no,
the social theorist. Tell me a little bit about why you won't stop talking about this book.
Well, John, I
really won't stop talking.
As you have pointed out to everyone, I'm a simple person, and so I do like books that have a one-word title like When.
But what's it about?
But what I think is interesting about it is saying that we make decisions about all sorts of factors, but we don't consider time. So when you think about having a meeting, you think about who are going to be the participants, what you're going to cover on the agenda, what are going to be the outputs, where it's going to be, but you don't think about when. And it turns out that time of day matters a lot. So for most people, in the morning, they're most productive and able to work on analytic tasks. Then there's kind of a midday slump, and then they come back and recover their creativity later.
My mother told me this many years ago. Now, how is this even relevant to healthcare?
Well, I think it's relevant in a couple ways. One way is for healthcare workers, if they are actually performing a surgery or something in the morning, that's actually when you want to go in because they're going to be much more productive and less likely to make an error at that time that could really hurt or even kill you. And then it means that you have to figure out what you're going to do if it's later on. I mean, if you want to be there. Yeah. And then the second part is that for more broadly, not for healthcare workers, but just in terms of wellness, there's a lot of good tips and tricks in the book about how to take care of yourself, how to recognize your chronotype, which is, are you
big
kind
word
of an early?
For you.
Yeah. Well, I said it slowly and I rehearsed it a couple times before we came on. So the chronotype is kind of the type of person you are based on time. So there's a lot of people who are just sort of in the middle. For most people, that means that they're productive in the morning, then the slump, then later on they recover. There's some people that are really early morning people, the larks, and there's some people that are really the night owls, and they have to adjust. So I think generally for wellness, the book has some pretty good tips about how you use sleep, how you recognize where you are, how you try to avoid depression, how you use different times of the year.
Enough. Before I want to go for my nap.
Yes.
I think we ought to really think about going through the lightning round.
Yeah. All right. Well, if the nap doesn't strike you, then the lightning will.
David, this government shutdown, what do you think the impact's going to be on healthcare?
John, the thing's driving me crazy, and I can't even imagine being a government worker, being forced to come to work, not getting paid, essentially as a slave. I think it's taking a hit right now on mental health, and very soon we're going to see that drugs are not being approved because the FDA does not have the reviewers in place.
Government, do your job. I noticed that the FDA acknowledged that it was soon to resume some oversight of some high-risk foods. It's just insanity.
John, a new year and new laws, including recreational marijuana being legal. What are the police going to do to enforce driving under the influence?
Well, I mean, I think you should be concerned. But currently, there's no good blood test and in-field test for police officers to use. And so I think what you're going to see is a lot more in-field tests of coordination and cognition because we know that people are going to overindulge, and we need to make sure the police can do their job, even if you're at the wheel.
John, my suggestion is a little simpler. Munchie detector. You just give them a hamburger and see if they can stay away from it. John, we're into January, which means you must have already broken some of your New Year's resolutions. Which one?
Sadly, I have. I'm already not getting enough sleep, but I'm hoping to come back on trend. How about you?
Well, John, I was hoping to read 20 books this year, but so far I'm stuck on the one.
The one or the when?
The when.
So, David, who's likely to prevail in the Super Bowl?
Well, John, I think the logical people are saying that the Saints will go marching in, but we got to stick with Tom Brady and the Patriots, John. Let's face it. We predicted Tom Brady was going to be the MVP of Major League Baseball. At the same time, we predicted the Red Sox were going to win the World Series back in April. So, got to go Patriots, John. What do you think? Going to contradict me on that one?
Go Patriots.
Well, that's it for this edition of CareTalk. If you like what you heard or what you saw, make sure to subscribe using your favorite service. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching.